Hello, welcome back to Simply Women's Health with CJ. Today we're going to talk about week 20, the halfway point of your pregnancy. At this point, the top of your uterus, also known as the fundus, is located right about the level of your belly button. Speaking of belly buttons, you may notice that yours has gotten flatter, or your innie might be becoming an outie. Most of you are starting to look a little bit pregnant. Because that uterus is growing, you may notice that your skin is itchy, you might be getting stretch marks. I encourage you to apply a lot of moisturizer to that tummy. You may be getting back discomfort. Stretching exercises, a nice warm bath with Epsom salts, a massage, those can all help. You might be noticing that your hair and nails are growing faster. You may be more constipated, which unfortunately can lead to hemorrhoids. You also may be having leg cramps. I encourage you to stay well hydrated to keep those at bay. So what's normal? It is very normal for you to have cramps, also known as Braxton Hicks, twinges, round ligament pain, those stretching pains down deep in your pelvis when you make a sudden movement. What's not okay? Bright red bleeding that's enough to saturate a pad, cramping that won't go away. If you have water running down your leg and you know you're not urinating, if you have severe pain of any kind that is persistent, please contact your OB provider. So what's going on with your wee one this week? At 20 weeks, your baby is measuring just about 10 inches or 25 centimeters from head to toe, which is roughly the same as a spatula. He or she now weighs about 11 ounces, the same as 330 grams, which is about the same as 2 baseballs. Interestingly enough, the human heart also weighs 11 ounces. Your baby weighs about the same as your heart right now. Your baby is covered with fine hair that is called lanugo. He or she has fingernails. Heart rate is 120 to 160 beats per minute. If you are carrying a little girl, she has her uterus, she has all of her eggs. So technically, you are not only carrying your daughter, you are also carrying part of your grandchildren. If you are carrying a little boy, his testicles are now descending out of his abdomen into his scrotum. You have an OB visit this week. If so, I would assume you are having your anatomy scan. That is a big ultrasound that takes generally 30 to 60 minutes. They're going to look the baby over head to toe. They're going to look at the placenta. They're going to look at the umbilical cord, make sure everything looks okay. They may offer you a genetic test called an alpha-fetoprotein. This is a blood test to see if your baby is at increased risk for a neural tube defect. It is a time-sensitive test. It has to be done between 15 and 21 weeks. You're going to want to check your weight. Don't worry if you haven't gained any weight yet. Average weight gain in the first half of pregnancy is anywhere from 0 to 5 pounds. So what should you be doing at this point? I encourage you to make an appointment with your dentist and get those teeth cleaned. Now that you're feeling better, time to take care of your teeth. I encourage you to start looking for a pediatrician or somebody who's going to care for the baby after he or she gets here. Also time to start thinking about those birth plans. What do you want your birth to look like? What questions do you have for me? I'd love to hear from you. Please drop them in the comment section before, and while you're down there, go right ahead and hit that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.